This vaccine equity video series is produced by the Public Health Alliance of Southern California. Our series elevates promising and replicable practices for equitable vaccine distribution. Practices happening both here in California and across the nation. Our video series will showcase community-informed and equity-centered practices that specifically aim to reach disproportionately impacted low-income communities and communities of color. My name is Marley Williams, and I am the Health Equity and Justice Manager here at the Public Health Alliance of Southern California.
And I'm Dana Sherrod, Birth Equity and Racial Justice Manager for the Alliance. The Public Health Alliance of Southern California is a coalition of the 10 health departments here in Southern California. Collectively, our members represent 60% of California's population. In this video, we talk with Katie Balderas, the Equity Officer from the City of Long Beach, and Sharon Jackson, a Long Beach native representing the community-based nonprofit Elite Skills Development. Katie and Sharon specifically discussed the city's efforts to build trust and ultimately vaccinate older Black adults in Long Beach. They'll talk in detail about a recent mobile clinic event that brought together Black churches, the city, the health department, and other community partners to successfully vaccinate over 200 Long Beach residents, 95% of whom were Black or African American. Katie, could you tell us more about your recent partnerships in order to reach older Black adults in Long Beach?
So we've been meeting with a group of community partners weekly to really brainstorm and troubleshoot many of the equity issues and barriers that people are facing. And when our public health emergency management team, the team that's distributing the vaccine, realized that these mobile clinics were going to be a really promising opportunity for us, they quickly started planning out the next month of allocating first doses for these mobile clinics. Sharon had been a part of our work group. She's worked for the city, so she knows how we operate and was able to really, cut through some of the red tape that I was up against. And this couldn't have happened without, Sharon and the partnerships that she brought in.
The weekly meetings that we've been having in terms of the diversity team and the equity team, the issue of mobile clinics came up, and I was on the call as well as Pastor Gregory Sanders, who's the president of the Long Beach Ministers Alliance. The two of us got together and said, hey, we want to have that first mobile clinic in the African American community. So the fact that in our weekly meetings is sort of a brainstorming where all things are discussed and ideals are put out there, and we called Katie and said, whatever we need to do, we'll find the space, we'll call the people, we will create an environment where people want to come if you guys are willing to trust us as that location to host the mobile clinic. And it went from there.
That's great. And Sharon, can you actually tell us more about your specific role in this partnership effort and sort of give us an overview of the role of the key community partners?
And having lived here in Long Beach, having gotten vaccinated myself, having gone through the process of registering and trying to track down an appointment was daunting. And so we recognized that if our seniors, especially our African American seniors, were not being served, they probably wouldn't be served under just the regular system because they weren't going to log onto a computer and answer the 20 questions and understand them. So when we started talking about this as a partnership, we had some goals and objectives that we set for ourselves. It was my small nonprofit, which is Elite Skills Development, the Ministers Alliance, as well as some of the other community groups, and then the church kind of mapped out how best can we go about reaching these seniors. And we set some goals for ourselves. We said we were going to create a space that was culturally affirming, so it didn't feel like you were coming to a clinic, you felt like you were going to an event. We said we were going to have excellent customer service. We were going to have people there, volunteers who'd be able to answer questions. We also said that one of our goals was to help build trust. So I think a key component of the overall planning was the involvement of the pastors, the ministers. In the African American community, our pastors and ministers still hold a position of trust, a position of authority. So we told them that, yes, we want you to come. You will see pastors literally handing out the hand sanitizer and talking to the members. But we also knew it was important for them to get the vaccination themselves. So we took lots of pictures. We did videos for them to take back to their congregations and to be able to work with their congregation. So not just the 200 people who came that day, but we envisioned that then this would be able to spread much broader because they can talk about their experience, first of all, and then they can say, this is what happened to me. My arm was sore or it wasn't. And we also knew that it was going to be multi-generational because a lot of the seniors were going to be brought by their grandchildren or by their sons or daughters. So that whole sense of kind of it being a family, we wanted people to feel comfortable when they came.
Could you talk about more of the elements that you all had in place that were culturally affirming for older, Black adults as they were participating? What did that look like?
Well, again, the theme for the clinic and the campaign that we worked off is Black and Well in the LBC. So this was not just a vaccination clinic. We had banners, very colorful, that we posted around that said Black and Well in the LBC. We had balloons, we had music. Seniors come early. So we had to be ready early. So those who had appointments at 10 o'clock were there at 9 o'clock. We had to have chairs because they were going to be there for a while. But that is the nature of seniors. They wanted to know where the place was, that they could find a park. So we had to be ready early. It's not just our seniors who have a historical knowledge of having been mistreated and things like that, but there are a lot of young African Americans who are very reluctant about taking the vaccine. So we tried to have some multi-generational staff there. We also recognized from the clinics that I had gone to that the technical staff, those administering the vaccine, there are not a lot of African Americans. So we invited one of our community members who's a registered nurse, African American. She came to be there just to be in that area afterwards to help people to answer questions. We also had to have enough people there who were able to patiently answer questions.
And I'm curious what else the outreach looked like to promote this event. I think there was such a great name and a great title.
Well, we did outreach on a number of levels because, again, recognizing our population. So we did create a very specific flyer that talked about this clinic. It was real simple, to the point, gave the time. We didn't give the actual location in terms of a physical address. Because again, it was a mobile clinic. It's a very dense area. And so we did have some concerns that we could be overrun by people just coming. So we did give the basic information. We provided 2 phone numbers. So this was all personal contact, and they called us. And so we literally took in the 200 and some odd phone conversations with individuals, and we registered them over the phone, walked them through all of the questions and answered their questions. So those who are working in our call centers, my hats go off to them. It's exhausting. Literally, it is exhausting. But we also knew that that's what it was going to take. I would say that probably 75% of the people who came to this clinic probably would have never made it to the convention center.
How has the city been able to support financially or otherwise community partners on the ground?
We ourselves haven't really gotten a ton of funding to directly support community-based partners, but we have worked with the Public Health Institute through the Together Toward Health Fund. And originally this equity subcommittee really formed around the partners who were funded to do direct outreach and education in the census tracts most impacted by COVID. So the subcommittee started with those 5 grantees and then has grown from there as we realized that those organizations only really represent a small portion of the impacted communities. Sharon mentioned that she's working on the Black Health Equity Fund. That was actually funded through CARES Act. So the city set aside about $1 million to focus on the disproportionate impacts of COVID on our Black and African American communities. And so some of the organizations who were funded through that are participating, as well as other organizations that were funded through CARES to do education and outreach as well.
How do you see yourselves building on this effort to continue to advance equitable distribution of the COVID vaccine as you are expanding eligibility for more folks in Long Beach?
I mean, I think as Sharon mentioned, having a culturally affirming space to start to build trust and awareness of the vaccine, I think was really critical, especially as we're just getting this started. We're in, the first month or so of it being really publicly available. But as we go, I want people to be able to know that they can just go to their local church or their local pharmacy. They know where where they can get it in their own communities, and that they don't have to go to a big drive-through or wait hours in order to be able to get it, but that they'll understand that the community, that the city is really trying to get vaccine where they are and meet them where they're at.
But we'll also have to continue with the education campaign, because people do still have questions. Each sort of generation, if we want to say, has different concerns, have different issues, and we've talked to sort of the effectiveness of it a lot. But as we get into those younger populations, especially those who are still in childbearing age and things like that, we need to talk more about the science, about their concerns and their issues. So ongoing education is going to be really important. So we'll have to continue to refine the message.
So Katie, how could health departments be proactive in engaging the trusted community partners, engaging the leaders who are representative of communities most impacted by inequities?
I think it starts with just being humble and recognizing that we don't have all of the information that communities hold. I think in our first few subcommittee meetings, we started off by asking the question, what are you hearing? What are you seeing? What misinformation have you heard from community members regarding the vaccine? And then we were able to start to provide more information to trusted messengers. And so I think that that's one of the key ways to even start the conversation.
If another jurisdiction were interested in replicating this type of effort or a similar effort, what are some of the key recommendations you would both make to ensure the effort is a success?
Some of the key lessons we learned was it does require a partnership. I don't think there's any one group that could make it happen. So by bringing together the community, bringing together some other organizations, bringing together the pastors, that allowed us to sort of cover the needs, because we had people there who could meet individuals where they were. So those who were kind of questioning it from a faith perspective, there were people who could talk to them about that. And lots of the concern about the vaccine, it kind of has its roots in faith. So we had that. And then from more of a medical or technical standpoint, we had some individuals that were part of our team who could help to ask that. And then overall, just welcoming. That's the key part of it. I guess it's coming from a point of service and recognizing that we will all benefit from this effort. So if you start from that perspective, then you can do it. I mean, all the other hurdles seem minor and you just figure, okay, well, how do we overcome that? But if you start from kind of that sense of compassion and then recognizing that you can't do it by yourself, that you require the city, you require the legal, you require that, then it just starts from that point. While it was hard work and it was, we took a nap afterwards, it was also very rewarding work. And actually, I got a thank you card today from one of the ladies who came to the clinic, and she just was thinking, she's 92 years old. I think that, mobile clinics and trying to create that space, it could be replicated throughout.
I know that every city has to have a Sharon, and Sharons make the world go round. So find your Sharons, because they're the ones that are the doers, and they're connected, and they're fun to work with, and their heart is in it with you. While I think that Sharon is a dive into in Long Beach, I know that there's lots of people who really deeply care about their communities and making sure the vaccines get to them. So working with whoever those people are, and really sharing your appreciation, because we certainly, as a health department, as a city, we certainly couldn't do it alone.
The city did recognize that we had something to offer to this. So it wasn't just, this is the law, this is the way it gotta be. It wasn't like that. They let us do our part, and we respect and honor them doing their part. And so together, it turned out to be a good event, and we were able to serve the community.